Right, perfect. Good morning, everyone. Welcome to Marketing Moments, the first of a series of webinars that we are doing here at Ally Care Time with our partners, 52 Weeks Marketing. Please make note before we start the call, we have this series every month. Our next one is on May 8th, Unleashing the Power of a Salesperson. I can't wait for that one as a salesperson myself. We also have one on June 12th, which is Systemize Your Marketing for Accelerated Growth. On July 10th, Speaking Your Referrers Love Language. Really curious about that one, Debbie. And August 14th, From Call to Care, which is Mastering Referral to Client Conversions. Welcome to the call, everyone. My name is Julio Barea, Vice President of Sales for Ally Care Time. We're a small software company that works with agencies like yours, helping you provide better outcomes, become more efficient, grow your business, and particularly work on increasing your revenue cycle management systems. I'm joined today by the incomparable Davey Miller, who is the owner and CEO of 52 Weeks Marketing, as well as the owner-operator of Senior Helpers in Nashville, one of the largest home care agencies in the Southeast. Good morning, Debbie. I'm so happy to be here with you today.
Good morning, Julio. I'm so happy to be with you as well.
Fantastic. So what we're here to do today is to talk a little bit about your experiences in marketing. But before we start, I wanted to chat. It's amazing to be here because if I recall correctly, we started this conversation 2 years ago at HCAP in Florida, right?
Yes. Yes. We said we've got to partner. We've got to do things together.
Right. We were booth buddies. And if you
Yes.
folks on the call know that when you're booth buddies, you spend 8 to 10 hours a day next to people and you get to know them really well. And I have to say that, and Debbie, I think you and Dylan and your daughter are fantastic humans. And I wanted to find a way to work with them. And it took me 2 years to figure that out. But here we are. Couldn't be more excited. So why are we here? Well, I work with home care agencies and listen to them every day. And the commonality between those conversations is they want to know how to grow their business. And I can't be more excited to hear you share with us your proven marketing strategies, the innovative solutions you're gonna provide to help differentiate these agencies and get more referrals. But what I'm really curious about, Debbie, is after running a super successful business already, what led you to start 52 Weeks Marketing?
Well, when I first started my home care agency in the Nashville area, I was the one out there pounding the pavement for the first 2 years and was able to get to about $2 million and knew that I needed to expand my reach. And in order to do that, I needed to bring on some more support, another marketer. And so during that time that I was out there, I realized, my gosh, in order to reach and build those relationships, you need to have many touch points with those referral sources to develop the relationships that I needed to keep the phone ringing on a regular basis. And so the challenge is, what do I talk about with these people every single week to keep it fresh and new? And so luckily, having had a very strong sales and marketing background, I worked for big pharma for 15 years before coming into home care. And so that gave me a breadth of understanding of reach and frequency, which we'll talk about in a minute when we talk about systematizing your marketing approach. So what I did is had to create my own system, materials, something fresh and new to talk about. And then as I was able to equip my sales team, realized that there are other home care companies across the country that have the same challenges. And so I was able to commercialize the system, and now many users we have across the country that are using our system to help them grow their organizations. So it's just been awesome. We just came from a franchisee conference and talking to a lot of franchisees who struggle with the same things. And so we've got a really nice systemized approach that's really going to help them.
I really like that you say systems. You know, it's something as somebody who runs a fairly large business, systems are incredibly important. And if you want to grow, you have to have something that's scalable. It can be duplicated and easily handled by people who may not be experts or professionals in whatever you have them doing. So I think it's really, really neat how you turned it into a system, something that everybody needs. So in your opinion, as someone who's been doing this, what are the biggest opportunities and challenges for, agency owners trying to grow these systems?
There are a lot of opportunities right now. In fact, this is an amazing time to be in home care. I say that quite often, and people are like, but we just came out of the pandemic. Yes. And The pandemic helped people realize how important it was for folks to be able to stay in home and get the care services they need right there in their own home. And so there is an incredible movement toward home-based care models. And everyone's jumping on this bandwagon. We've got hospital to home programs, SNF at home. We've got home health partnering with healthcare systems to be able to manage those patients at home. Now, here's the challenge. These organizations do not have the infrastructure necessary to provide that one-on-one care, but we do. And so there's unbelievable opportunities to partner with these healthcare systems where we used to be seen as the ugly stepchild. We are now the partner that they need to truly implement these care models in the home. So it's an amazing opportunity for us, but the challenge is you've got to have a dedicated person out in the community connecting with these folks, being at the table. I heard a saying recently, if you're not at the table, you're on the menu. So there are opportunities to develop some great partnerships with these organizations and be that in-home provider that will help them keep those patients out of the hospital, that are going to help them to continue to recoup, say, after a stroke or after hospitalization. And so they more than ever need a partner, but we've got to be there developing those relationships with those folks. And the challenge for a lot of the home care organizations that we talk to is they have had bad experience, say, with a salesperson or a marketer. And a part of that is because a lot of home care providers, in fact, only 3% of home care providers have any sales and marketing experience. And so they tend to hire a marketer and cross their fingers and hope for the best. They aren't necessarily equipped to, first of all, they don't have a system in place to hire them into and hold them accountable to. And so they just really are hoping that this person's going to be able to generate referrals and develop relationships. And so that's been a real challenge for folks. And so one of the things that we try to do is really help them hire somebody that's going to be well suited, and then hire them into a system that they're going to be able to hold that person accountable to. So, they lack that experience. And so what happens as an owner, big challenge, a lot of fires to put out every single day in this business, but having a dedicated person so that no matter what is happening in your organization, marketing is still happening. The phone is still ringing. You can't take your eyes off that marketing ball. You've got to be intentional about growing your business. And so that's I think the biggest challenge for folks is not to get sucked into all of putting out the fires. And because a lot of people don't have that marketing experience, they tend to do what they know. And so, having a dedicated person is the answer. It's just having the model that you're able to hire them in to manage.
Yeah, I love hearing that. As somebody I consider myself a professional salesperson, is professionalizing that part of the business. And so many of these owners, to your credit, folks on the call, you're here because you're caretakers. You care about people. You want people to be safe and healthy and cared for, and that's why you're in this business. So letting people like me take over that part of your business, people like Debbie, to show you how to walk that system, I think that's an outstanding thing, and I'm really happy that you're doing this. So maybe we should take a look at what you'd like to share with us today, Debbie. Let's talk about.
Absolutely. Before we do that, we've got a poll question. In fact, I'd love to know what kind of experience the folks on the phone have. So if you're as an agency owner, do you have previous sales and marketing experience? So if you could just answer yes or no, and then we'll be able to get into to teaching for today. But this will be interesting for us to see.
This is super neat to see. Thank you, Debbie, for bringing this early in the conversation. Interesting. It's pretty heavy on the no.
Yes. Yep. I'm not surprised.
60-40. Look at that. Pretty heavy in the no part.
That's actually higher than what we normally see. There may be some sales and marketing people on the phone, not just owners. So that's awesome. All right. And you just let me know when we're ready to advance. Okay. I think that's my cue. All right. So let's talk about powering up our referral pipelines. And so one of the things that I really encourage owners when we first start looking at helping them is that you don't want to have all your eggs in one basket. All right. We've seen a lot of folks have one or two major referral partners, and that can be really risky because there is a ton of turnover that's going on in the industry right now. And so if you are counting on one or two care managers to really keep your business afloat, that's not ever a good strategy. So you really want to diversify your revenue mix as well as building many referral pipelines. And so that's what we're going to talk about today, is really bolstering. And ultimately what you want is to be getting referrals from as many pipelines as possible, right? So what are some of those things that you want to be focusing on? Direct to consumer. So I'm going to delve into each one of these, and we'll talk about some best practices for all of these. Your clients are an amazing referral source. Lead providers like A Place for Mom, caring.com, those kinds of things. Government and payers. And so when I say diversifying your revenue sources, I think this is becoming more and more important as our prices for care are going up. And I'm going to share some statistics on how many people can actually afford care if they're paying only by private pay. And then finally, my favorite, my baby, community referrers. I think this is where we unfortunately don't see enough home care providers putting enough emphasis on, and we're going to talk a lot about that today. All right, so let's dig in and look at direct-to-consumer strategies. And so when you're reaching your target audience through a direct-to-consumer model, you really want to take a multifaceted approach that's going to leverage several of these various channels. Okay, so obviously search engines. You want to be seen when somebody searches Google specifically. I mean, lots of other search engines that you want to ensure that you are getting that visibility that's necessary, because this is typically where somebody's going to start. If they're doing a search, even if they know about you, if they've gotten a warm referral, they will often go and do a search and see if you're legitimate or whatever they might be. So search engine optimization is really important so that you are getting that visibility and that high visibility in those high one or two or three spots when somebody does search you. Social media is a great source also. And what that does is it just expands that reach a little bit, ensures that you're prominently seen, as well as it gives you an opportunity to engage with your audience, right? You can reach out to them, engage with them, mobilize them, they can forward things. So it's like obvious, it's like expanding your sales team. It's really, really awesome. And then there are the traditional sources: newspaper, magazine, radio, even TV. I know a lot of home care owners that have like a regular radio show. Really cool if you can get it, and that you have the time to do that. So there are a lot of things to consider, and certainly it really understanding your community, understand what works in your community, and I'll give you some examples of things that I use in my business. For example, let me just touch on this. Senior resource directory. My gosh, in my area, because all of the care managers in the hospitals use that and hand it out, we have to be in there. All right, I have a little area in Murfreesboro, Tennessee, the VIP magazine. Everybody and their brother looks at the VIP magazine. So that is a great place for us, and we actually have a monthly ad that we use, and it makes sense for us. I don't do that anywhere else in my community. So it's understanding where to put your money because you only have so much budget. So what are some best practices? Obviously, a well-optimized website so that you are getting picked up on those searches. Using and understanding the right search words if you are using Google pay-per-click. Local SEO. Mobilize your staff. Look for ways. Post anything and everything. I heard a great strategy the other day. We all are doing caregiver training and caregiver orientation. End your class with getting every one of your caregivers to do a Facebook review. Great way to get some of those reviews up there. So again, that's all going to help you with your SEO. And I would really encourage you to be strategic, as I said. Determine what your budget is, and you know, when I said a lot of people are putting a lot of eggs in one basket, unfortunately, a lot of people are putting all their eggs in this basket and not thinking about other things, and it can be very costly. So that's just be very wise with your budget and be thinking about these other pipelines as we go through them here. Clients love this. I have a really great story that I'm going to share with you. But our clients are an awesome source for referrals. You want to focus on your active clients and also previous clients. Don't forget about them. All right. So I just had a situation. I was in at part of town that I don't normally go to. And it reminded me of a client that I had that we actually provided care for her husband for 8 years. Right? He passed away, and I haven't thought about him for, gosh, a couple of years now. We went to his funeral probably 4 years ago.
Oh, wow.
Anyway, I thought about the wife. I actually had her phone number because, by the way, I used to go to this house all the time to do an orientation to client with my caregivers. I called her up. Literally, this is 4 years later, and I said, "Hi, I was just in your area. It made me think about you. I wanted to see how you were doing." Blah blah blah. A week later, I had a referral from her neighbor. So it's just an awesome story, and it really made me think, hey, what are we doing? Are we doing enough to stay in touch with our previous clients? Because in this business, everyone knows someone that needs care. That never ends. All right, so what are some of the things you want to do? Obviously, stay connected to them, right? Your current clients have strong communication where you're constantly checking in, doing supervisory visits. If you do e-blasts or if you have a newsletter, include them in that. Okay, really important so that they see everything that you're doing. Also, number one, keep your client satisfied so that they do recommend you. So if you're doing any surveys, very important to act on results so that they see that you're trying to do your very best to provide the best care possible. If you're not doing surveys, you should be so that you understand what that level of satisfaction is amongst your clients. Very, very important. Be intentional about asking referrals. Train your staff when they are connecting. We connect with our clients on a bi-weekly basis. So we've trained them to ask, hey, do you know anybody else that could be benefiting from the services like you're receiving? Offer discounts. So if they do send a referral, they get a discount off their service. And then invite them to any educational events that you're doing and ask them to bring a friend. We do in my area a lot of trainings and different things for families, and we make that accessible to our current clients as well. All right, our next pipeline, lead providers. And so some of those lead generation services like a place for mom, aging care, can be very, very helpful. What's awesome about them is they are spending a ton of money on direct-to-consumer advertising, way more than you could ever do. And so what they do is great. They filter down and qualify those clients and can provide referrals to you. So I think it's a great source. It's typically pretty cost efficient. Here are some strategies to do. So you want to develop partnerships with them, negotiate the fees, all right? And if they have local people, like a place for mom will often have a local coordinator, meet with them, connect with them, because the more personal a pass off can be, the higher your conversion rate is going to be. All right, now let's think about conversion rate, because I hear a lot of people complain about the lead providers and the low conversion rate. Typically, the number one reason they don't convert is because we don't follow up quick enough and we don't follow up often enough. So we need to have several touch points. 80% of people will convert after 6 touch points. So if you're only making one connection and you give up, what a waste of money that was. Okay, so let me tell you a little trick. When you're calling a lead, and by the way, in my office, if they're calling us, we pick up that phone before the third ring. So we have a whole system where it's within the third ring. If it's a digital lead that gets forwarded to us, you've got to have somebody that's jumping on those within seconds. I mean, couple of minutes the most. So that's really, really important. And then following up with them. When you call them, call once. If they don't answer, hang up, call again. Don't leave a message. Then text, then email. And you do that for days. We have a rule in my office that you call them until we get a restraining order against us. I'm kidding. But you want to continue to call until you have a reason not to call. That is that they've they've sided with someone, or they've chosen someone else, or whatever it is. But a place for mom, this is really interesting. I spoke with Lori from a place for mom. She said 40% of the calls come after hours. So if you don't have somebody to follow up on those leads after hours, you're missing out on a huge opportunity. So you need to be thinking about that from an infrastructure standpoint. The other thing is, she said 80% of leads convert within the first 30 days, but then there's another big lift after 60 days.
Very common.
And so putting them in a drip campaign can really help, even if they've chosen someone else, because chances are maybe they've had a staffing issue and they're not happy with the company. So they'll be open to another option. So there's just some great strategies to think about. Next one, before we get to our next pipeline, one of the biggest barriers that we hear to care is what? Cost, right? And it's becoming more and more of an issue because of inflation, right? Our prices have gone up, and less people are able to afford to pay for care privately. Or here's what they're doing. They're settling with inadequate level of care because it's all that they can afford. So we're seeing that more and more. And statistically, only 20% of people can actually afford to pay for care privately. Isn't that amazing? And yeah, I just saw some statistics from Home Care Pulse that showed that the private pay portion of home care has declined by 7% year over year.
It's a huge number.
Yes. So we need to be thinking about other payer options, okay? And diversifying your revenue mix if you possibly can. So what do you want to think about? Veterans Affairs. We have the aid and attendance pension. That is a great opportunity for folks that were served in wartime. It also is a pension that provides services for the surviving spouse. So you can, if you've got a partner to help your clients too, that's great. If you are a community care partner, be thinking about that. If you're not, consider it. The rates have gone up for VA, that incredible. Some are like up to $55. Some states are $55. So incredible, where we used to, shy away from this a little bit. That's a really good reimbursement rate. Medicaid, if that makes sense for you, depending on again, reimbursement rates. Medicare Advantage, more and more plans are providing support for home care. Workers' compensation organizations like that. Long-term care insurance. Oh man, I love long-term care insurance. It built an incredible business becoming a long-term care advocate and expert. Something to think about. And then home equity options. So some best practices, obviously contract with these providers that make sense for you. Be connected to the care managers who are interfacing with families that are or the patients that are in need. Become an expert. Pick one of these payer sources, get to know it in and out, and then get out there and market yourself. Because here's the reality. Your referral sources, are dealing with this challenge. They've got folks that need help once they get home or when they're at home, and they can't afford it. So if you can provide that solution and help their patients through that, it is going to differentiate you. You want to be that one-stop shop. Hey, you don't have to know all the sources. Make your referral to me. I'm going to see what I can help them tap into, that kind of thing. So promote that expertise. We actually have an amazing 3-part series coming up. Take a picture of the QR code. I really encourage you, if you're looking at expanding your payer options, this is a great 3-part series that is coming up with the incredible Greg Bean from Paradigm. He's going to be presenting with me, and we've got some other folks as well. So consider taking part in that. All right, finally, my baby, community-based referrers. And so why is this really important? And back to having somebody strategically out there representing you in the community. And the reason why this is so important is because when you think about our business, it's really crisis driven, right? It begins typically with some mom, as an example, who's had an issue, had some sort of incident, and now family gets involved typically, right? And is at the point, maybe they were ignoring some of the red flags, but now this situation has happened and now mom needs a solution, a care solution. And so what happens? Well, during this period, this episode, this family is interfacing with many professionals along the way. whether it's the doctor, the rehab therapist, the social worker, the discharge planner, all of these folks are interfacing, helping them resolve this situation. They've got a care need. And so if we are not interfacing with these folks, we're missing an opportunity. And as a matter of fact, here's how big it is. 80% of the revenue generated in the home care industry comes from this type of referral source. So that leaves 20% that are coming from these digital Google leads. And so you've got to be there. You don't want to miss that. But if you are not engaging with these folks and influencing these people at this point of need, at that point of crisis, we're missing a huge piece of the pie. So that's really what we want to focus on. So you really need to have a system that's helping you build relationships with those folks. Okay. So we have a methodology that we use here at 52 weeks. It's reaching the right people and having enough of them so that you have that constant referral pipeline. That's, your phone's constantly ringing. You need to see them often enough to actually develop the relationship with them. And you want to be consistent by solving patient problems with your services and then holding your marketer accountable. So that's reach, frequency, consistency, and accountability. All right, so best practices, you want to have somebody dedicated. If it's you as the owner, that's great. You've got to be able to give it enough time to be out there. You need a database of referral sources and then have them on a routing system and schedule so that you're seeing them consistently enough, getting that weekly frequency, which is really, really important. Having strong materials and engaging messaging and things like that, something unique to talk about every week that keeps you with that consistency. A CRM that's going to help you to understand, how you're doing, keeping you on track with that reach and frequency, as well as understanding and giving you that transparency you need to ensure that your marketer's doing what you hired them to do. And then finally, having a really strong internal referral management system. So this is overwhelming for you. Don't worry, give us a call. We can help you with this. We can help you systematize this and make it a lot easier with our turnkey system. All right, so I think we've got one more poll before we turn it back.
Before we do that, Debbie, I actually have a couple of folks on the call that have some interesting questions. I thought it might be nice to answer them. I had someone ask, how late is too late? I thought it was an interesting question. If you're 10 p.m. where you are, do you wait till the next day to reach out to a lead? Do you send something at that moment?
If you got it at 10 p.m., I would reply to it at 10 p.m. If you got it earlier in the day, then probably not. Wait till the morning, or you could just text them, and if they want to call you, they'll call you. So, but yeah, if you got it right then and there, obviously they're probably in a crisis, and that's the only free time they had to be thinking about what mom gonna do when she gets home.
I agree. I don't think there's such a thing as too late. If they reached out to you at 10 p.m., that's because they're thinking about you at 10 p.m.
Yes.
Not that everybody's up at 10 p.m. taking leads.
By the way, they will be amazed that you called them.
They will. 100% they will. Absolutely. Thank you so much, Debbie. This was, I think folks on the call, this has been an amazing amount of information, Debbie. When I hear you speak about this stuff, it just
you didn't think I'd get through all that in such a short period.
I was shocked you got it in the time that we had. I'm really, really amazed, to be honest. But even more amazed I am is at the quantity of how relevant and specific the information is to grow a business just like ours, right? It's exactly the same thing. So if you folks like what you heard today, then please come back and listen to us again on May 8th, Unleashing the Power of a Salesperson. One of Debbie's points today was very important. Get yourself a marketer. Get yourself someone who has, frankly, sales and marketing brains, someone who's dedicated to the job, not someone who's picking up shifts when a caregiver doesn't show up, because we know that happens, right? They're going to teach you how the market is shifting and what it means to home care providers. There's a question about the 80-20 rule, Debbie. Probably don't have time today, but we can definitely cover that in that next call. Benefits of having a dedicated marketing salesperson, strategies for selecting the ideal sales marketing professional. That's incredibly important. And setting goal and key performance indicators, all things that are really, really important in selecting a partner to work with. And by far, Debbie to me is the best marketer in the business.
Thank you. I think we have a poll question.
We do. Go ahead. What is your single biggest challenge with marketing your business? One, time to get in the field to market. Poor conversion rates from referral to client. I don't have a dedicated person to market my business. And not enough leads or referrals or all of the above. We should bet which one comes out ahead on this, Debbie. What do you think? I think dedicated person comes out number one. Oh,
I
no.
think all of the above.
All of the above, yeah. We have a few more folks, about 53%. I know you have an opinion. If you're on this call, you definitely have an opinion and you definitely have a problem that you want a solution for. All right. Looks like all of the above is by far running away with this, Debbie, for sure. So I definitely lost that one. I owe you a cup of coffee. Definitely. All right, folks, if you want to learn more, my name again is Julio Barea. We are with CareTime. We are absolutely dedicated to working with agencies like yours. We have all of the tools you need to do some of the things that Debbie's talking about. We have an integrated CRM. We specialize in the small to medium-sized home care business. And I'll be honest, different from anyone else you're going to talk to in our space. If we can't help you, we're going to tell you we can't help you, right? We want to work with people we can help. We want to make sure that you have a partner that works with us and works with you for a long time. Again, you can also contact 52 Weeks Marketing with my buddy Dylan Schwartz. The contact information is there. Take a picture of that QR code, and it's at 12:31. Thank you again, everyone. Debbie, thank you for doing this call with me today. I really appreciate it.
I think there are a couple more poll questions.
Oh my gosh. Okay.
Here
I
we
like how
go.
you keep me on point. Well done. Do you want to learn more about how CareTime can help increase your referral pipeline? Yes, you do. That's a big one. And do you want to learn more about how 52 Weeks Marketing can increase your referral pipeline? Yes, you do. And if you say no, thank you, we will not call you.
That's right.
That's right.
Awesome to be with you, Julio. Thank you all for joining. We look forward to having you back next week or next May
2 weeks, I think. So thank you so much, Debbie. Have a great day. And to everyone on the call again, thank you so much for joining us today. Best of luck in your business.